5, 4, 3, 2, 1. Start. The use of Ayurvedic medicines has seen a steady rise in recent years as more people seek natural and holistic ways to maintain health and well-being. Ayurveda, which has existed for centuries, is based on the principle of balancing the body, mind, and spirit. It emphasizes prevention of disease and promotes a lifestyle aligned with nature. In contrast, the allopathic system of medicine focuses primarily on diagnosing and treating diseases through pharmaceutical drugs, surgeries, and other clinical interventions. While both systems have their merits, there is a growing opinion that Ayurvedic medicine offers a more sustainable and safer approach to health compared to allopathic medicine. One of the main advantages of Ayurvedic medicine is that it uses natural ingredients like herbs, roots, oils, and minerals to treat various conditions. These substances are processed in traditional ways to retain their healing properties. Because they are derived from nature and not synthesized in laboratories, Ayurvedic medicines generally have fewer side effects. Many people have reported using Ayurvedic treatments for chronic illnesses like joint pain, digestive disorders, skin problems, and stress-related conditions with noticeable improvement and minimal complications. In comparison, allopathic medicines, while often effective for short-term relief, are known to cause side effects, especially with prolonged use. Painkillers may relieve discomfort temporarily, but can lead to problems like kidney damage, stomach ulcers, or dependency. Similarly, antibiotics may treat infections quickly, but their overuse has led to resistance and weakened immunity in many individuals. Ayurvedic medicine takes a personalized approach to health. It views every individual as unique and recommends treatment based on a person's body type, environment, habits, and emotional well-being. This individualized care helps in identifying the root cause of illness rather than just suppressing symptoms. Allopathic medicine, on the other hand, often uses a one-size-fits-all model where a particular drug is prescribed for a specific illness regardless of individual differences. As a result, the deeper causes of disease may remain untreated, and the symptoms may reappear once the medication is stopped. In contrast, Ayurvedic treatments focus on long-term healing and encourage patients to adopt healthier lifestyles through diet, exercise, meditation, and detoxification methods that suit their unique constitution. Another benefit of Ayurveda is its emphasis on prevention. The system teaches people how to live in harmony with natural cycles and how to maintain a balance of energy within the body through seasonal routines, mindful eating, and mental clarity. By practicing such preventive care, people can reduce the likelihood of developing serious diseases and avoid the need for aggressive medical intervention later. Allopathic medicine is often reactive rather than preventive. It usually comes into action after the symptoms have become visible or the disease has reached an advanced stage. Regular checkups and health screenings are promoted in allopathy, but they do not always lead to a lifestyle change unless a problem is detected. In contrast, Ayurveda encourages daily habits that support immunity and resilience, reducing the need for medical treatment in the first place. Cost is another important factor that makes Ayurvedic medicine more accessible and practical for a large population. Many Ayurvedic remedies are affordable and can be prepared at home using common ingredients. The treatments do not usually require expensive diagnostic tests, hospitalization, or specialist fees. On the other hand, allopathic treatments, especially for serious illnesses, can become a financial burden due to the high cost of branded drugs, medical tests, surgeries, and hospital stays. The economic aspect makes Ayurveda a more viable option for people in both rural and urban settings who may not have the means to afford modern clinical treatments. The long-term benefits of Ayurvedic medicine also make it appealing. Instead of offering instant results, Ayurveda works gradually to cleanse the system, strengthen the internal organs, and build immunity. The slow but steady healing process leads to deeper transformation, and the effects are usually more lasting. Allopathy, while often providing immediate relief, may not always ensure that the underlying issue is resolved permanently. In some cases, long-term use of synthetic drugs can even lead to dependency or deterioration of natural bodily functions. For example, the excessive use of sleeping pills can affect natural sleep cycles, and long-term medication for lifestyle diseases can lead to new health issues. Ayurveda also incorporates mental and emotional health as an essential part of treatment. Techniques such as breathing exercises, meditation, and therapeutic massages are used to reduce stress and promote mental clarity. This holistic approach recognizes the deep connection between the mind and the body and addresses health from both dimensions. In contrast, allopathic medicine often treats physical symptoms separately from mental conditions. A person suffering from both anxiety and stomach issues might be prescribed separate medicines for each condition without linking the two. Ayurveda, on the other hand, would treat the root cause that may be affecting both mind and digestion simultaneously. The environmental impact of Ayurveda is also lower. Since most of the ingredients used in Ayurvedic medicines are biodegradable and plant-based, they are less likely to pollute water sources or harm ecosystems. In contrast, the pharmaceutical industry produces large quantities of chemical waste, which if not handled properly, can contaminate the environment. The production of synthetic drugs also relies heavily on industrial processes that consume significant energy and resources. That said, Ayurveda is not without its limitations. It requires patience and a commitment to lifestyle change. Results may not be immediate, and individuals must often follow detailed instructions regarding diet and behavior. Also, not all Ayurvedic practitioners may be well-trained, and the quality of medicines may vary without strict regulation. However, these challenges can be addressed through better standardization, research, and integration of traditional knowledge with modern science. Allopathic medicine excels in emergency care, surgical intervention, and acute infections. The best approach may not be to replace one system with another but to integrate both in a way that allows patients to benefit from the strengths of each. Still, for general health maintenance, prevention, and long-term healing, the Ayurvedic approach offers many advantages that are increasingly being recognized worldwide. Stop.